Hi, I'm James. Today we're here at Portsmouth Regional Hospital in Portsmouth, New Hampshire. It's my pleasure to introduce Dr. Moby Parsons, Orthopedic Surgeon. Thank you so much for joining us.
Thank you for having me.
I'd like to remind everybody out there in the Facebook world, please share any comments or questions that you may have for Dr. Parsons, and we'll be following up after this. So I know that Dr. Parsons, you recently came down to Portsmouth about a year ago. You joined Dr. King's practice. What brought you down to the Portsmouth community?
So I was up in Dover, Rochester, Somersworth area for about 14 years. Had a great practice that I worked with up there. Really enjoyed my time up there. But as I began to focus more on joint replacement, I was really looking for an opportunity to synergize with somebody that had the same practice philosophy and the same type of practice that I had, and also to try to concentrate my services in one location. With the type of work that we do, because some of our patients do wind up in the hospital, it's really nice to have your office inside the hospital so that you're right next door to your patients when they're here, so we can really keep a close eye on them and deliver the best kind of care. And it was just difficult in my old situation to have an opportunity to do that. And so it's really been an honor to come down here and work with Dr. King, who has such a sterling reputation, and learn some of the techniques that he's had. And it's been great to become part of the Portsmouth community, which has really been a terrific medical staff and great help in the operating room and everything. So it's been a nice change.
And I know that you're an orthopedic surgeon, but today we really want to focus on the Conformis custom knee as well as the shoulder you're doing with the Exactech. So, tell our audience out there a little bit about the Conformis custom knee, what it means to them, how it benefits you as a surgeon, the healing time, and all the great benefits that it offers.
Yeah, so we got interested in the Conformis knee about 3 years ago, maybe 3.5 years ago. The concept of the Conformis knee is that it's patient specific, or it's really a custom made knee. It's the only truly custom knee on the market. And the knee is made from a CAT scan. So a CAT scan is taken of the knee. It gives you a very accurate three-dimensional picture. So a CAT scan can give you a picture of the bone that's very, very exact. And then based on that model, the implant company, using special computer algorithms, can design an implant that exactly fits the shape of the bone. So rather than having a generic prosthesis, they can really customize it so it fits the bone exactly. And the theory behind that is that if it's custom fit to the knee, it works better, it feels more normal, it feels more stable. And that's something that patients nowadays are really looking for. We have patients that get knee replacements and they go back to jobs where they stand on their feet for 12 hours a day, and they really need a knee that feels like a high performance knee. I think, in general, knee replacement has become a very good and reliable operation, but there's still about 20% of people who may feel like it's not their normal knee. And so using a custom fit technology, the idea is to really try to close that gap so that, you don't have 20% of people who still feel like it aches or it swells or it feels a little bit stiff. And we've combined that with some rapid recovery protocols that we've developed here, and Dr. King has been working on for a lot of years. And I think combining this technology with the rapid recovery protocols that we have here has really helped people get better quickly. So I think this technology synergizes very well with the whole care process that we've developed at Portsmouth Hospital to get people back moving quicker and quicker. And so we've been very happy with it. We've used it for 3 or 4 years now. Our results have been very good and reliable. The technology works incredibly well, and it's been around for long enough that they've figured out some of the kinks, and with surgeon feedback, they've really designed these implants so that they work tremendously well. So I think it's been a real game changer in the market. I think it's something that we'll see more of in the future, custom-made implants, things that are 3D printed, and now that technology is here, I think it's here to stay. So.
And I think with the whole idea of, no knee is the same as somebody else's, is that even taking into accountability of, he's had a little bit of a wear or different, angles? Is that also being incorporated into the Conformis?
Yeah, when they get the CAT scan, they can calculate all that. They have sophisticated computer algorithms where they can look at limb alignment, and they can look at the wear pattern, and they have figured out ways based on the anatomy to allow the prosthesis to be designed and inserted in a way that you take all that stuff into account and you restore the anatomy and the alignment back to normal. So it's really quite remarkable.
And I'm sure everybody out there is, thinking, oh, this is really cool technology, but the question always comes up is, how quickly can I get back to doing my normal everyday activities, whether that's skiing, snowboarding, golf, swimming, picking up the grandkids, just going for a walk. I mean, what's the recovery time on the Conformis custom knee?
Yeah, it's really, it's a complicated question because it depends on a lot of different things, including how bad the knee is going into the surgery, how healthy and motivated is the patient, how deformed is the knee, how stiff is the knee. And so in general, we let people get up and weight bear on these things right away. We allow people to progress their activities as tolerated. I think with the rapid recovery techniques that we've developed, what we're seeing now is where people are at 4 weeks now is where they used to be at 3 to 4 months, several years ago. And so I think that we've sped up the recovery significantly over where it used to be in the past. But that being the case, they do still take time to get better. It's still a knee replacement. You still have to open up the knee and put the prosthesis in, and there's still quite a bit of rehabilitation that patients have to do. I think patient preparation, educating patients beforehand, getting patients ready for surgery, these are all things that we're paying more attention to now that also help speed the recovery process. Getting back to high-level activities, golf, sports, tennis, things like that, it's generally anywhere between 2 and 6 months after surgery, just depending a little bit on how well the patient progresses with their recovery.
And I know the best way probably is for people to kind of go to the Portsmouth website to find out more information about you and the Conformis, and then just getting it to come see you, then they should just call your office directly then to book an appointment?
Absolutely. Yeah,
Okay.
we're here to help.
That's great. I know we also are going to talk about today about the shoulders, the Exactech. Now, I know a little bit about Conformis, but tell me, what is Exactech, and how is that going to help the patients out there?
Yeah, so shoulder replacement is something that really is the crux of my background in joint training. So I did 2 fellowships in shoulder replacement surgery. And before I got to the Seacoast area, there weren't many people that were doing this. And so that's always been something that's greatly interested me, and I've been fortunate to have the opportunity to work with some of the implant companies, including Exactech, on prosthesis design. So I could spend literally the next 3 hours talking about shoulder replacement. But in short, Exactech is an implant company. They make a shoulder prosthesis. They have concentrated a lot of their energy on the shoulder. So some of the other big companies focus on hips and knees and shoulders and ankles, and Exactech has really focused a lot of their efforts strictly on shoulder prosthesis design. They've come out with a lot of niche products that have really advanced our ability to reconstruct shoulders that are very worn out. So previously we would have, we would encounter situations where the arthritis was so severe that we really didn't have good solutions, and over time the engineers in combination with the surgeons have really figured out what we need as far as implants to be able to deal with some of these incredibly complex and challenging situations, and how do we get these shoulders to a point where we can let people go back and play tennis and do a high level of activity. And Exactech has really been a leader in advancing the technology, the implant technology, to deal with these complex situations. The most recent thing that we've gotten here, which is something that's near and dear to me because I've helped develop it, is what's called a GPS, or guided personalized surgery. And it's basically a navigation tool where, again, we get a CAT scan of the shoulder. The CAT scan gives us, again, very detailed anatomy of what the patient's shoulder looks like, including the wear process. So when shoulders get arthritic, the socket oftentimes gets very eroded, and that erosion can affect the orientation of the socket relative to the shoulder blade. The CAT scan can calculate that for us with great accuracy, and then we can actually use the system to preoperatively plan the case. So we can pull the CAT scan up on a computer. We get a model that looks just like this. We can pick out the size of the implant that we want to put on there, and we can exactly determine the position that we want to put it in to recreate the anatomy. We can then take that plan into the operating room with us, where we have intelligent instruments in a computer system that allow us to navigate the case to the plan, so that we can exactly create in the patient what we plan on the computer. So it really improves our ability as surgeons to do a good job with the operation. And what we know is if we can get the mechanics of the joint back to the way they should be, that shoulder should function better, should last longer, and should allow people to do more without the risk of wearing their shoulder out. So this is something that we started doing here in October. It's been a great technology to have. We've done it in a lot of cases now. We're one of the few places around that has it. I think we're the only place in New Hampshire that has this technology right now. And so kudos to Portsmouth Hospital for helping bring that technology to us. It's something that we'll continue to use in the vast majority of cases that we do because it's so very helpful. And I think it's just a testament to how these technological advancements with imaging and computing can help us do a better job in the operating room and help the patients do better afterwards.
Well, and it sounds like you guys are really pushing the boundaries here with the technology here at Portsmouth. And it sounds like, we've got some patients out here who need this. You're a phenomenal surgeon. Tell us a little about the team that helps lends the support to you while you're in the OR.
Yeah, so I always like to say that you can't do surgery with one pair of hands. It really takes a team approach. It takes a team not just in the operating room, but the entire care process. And so we have a great team here in the office, including Stacy Riley, who's been, she's a physician assistant that has worked with me for 9 years now. So she really knows everything that we do. Dustin Forrest is a nurse practitioner who works here and really, is great about contacting the patients, making sure that the lab work is all good, addressing, anything that needs to be addressed preoperatively. We have a really comprehensive preoperative preparation program here, getting patients prepped and ready for surgery. And then, when it comes down to the operating room, we're fortunate to have a fantastic group of people down in the operating room who get these cases ready. There's a lot of instruments that have to come in and get prepared for the surgery. There's scrub techs, there's anesthesia techs, there's nurse anesthetists, there's anesthesiologists, there's circulating nurses in the operating room, and there's people working behind the scenes to clean the instruments and turn things over. And it really takes a village to get all this work done. And Portsmouth really has a crack team that helps us to do this. And then when we're doing the operation itself, having technicians that can stay on top of what we're doing, anticipate where we're going to go next with the case, it helps us get these cases done quickly. And they really have a great team of people down there. And I've worked at a lot of different hospitals, and you can tell when you're working with a good team of people. And I've been fortunate to have great teams everywhere, but certainly the team that we have here would stand up against any other hospital I've ever worked at as far as being great help to have. And then post-operatively, it's the same. We have great nursing care here, great case management. Our therapists get the patients up and moving very quickly afterwards, which is critically important. And then great discharge planning and preparation for going home. So I've been really pleased with the care that our patients have gotten here. I think it makes a tremendous difference because nobody really wants to have this stuff done, but if you have to do it, knowing that you're sort of in a team environment where everybody's focused on giving you the best outcome, I think it makes a huge difference for people.
And this is really exciting. I think what I took away from it too is that you're unique right here in the building as the hospital. So that puts you right at the care of the surgical team, easy access for the patients. So I really want to thank you so much for spending some time today. For everybody who's out there in the Facebook, please visit PortsmouthRegionalHospital.com, or you can call Dr. Parsons' office directly at the Knee, Hip, and Shoulder Center. And please leave any questions or comments, and we will follow up with you on all those. So thank you again.
Thank you very much.